Good evening and welcome to the extraordinary executive meeting for the 17th of December. Just a little bit of housekeeping before we start. Please can you ensure that any mobile devices or mobile phones are switched off. If you're not speaking or being asked to speak, please mute your microphones. If you do not mute your microphone, it will be muted for you. To assist people viewing the meeting, could everybody turn their cameras off? And only turn them on when speaking, and also introduce yourselves so that whenever you speak, you're known. To ensure smooth running of the meeting, could members wishing to speak please use the hands up facility on Teams whenever possible. Please note the meeting is currently being webcast live. So find my agenda. In attendance tonight is myself, John Halsall, who's the leader of the council, John Kaiser, who's deputy leader of the council and executive member for finance and housing, Parry Bath, Environment and Leisure, Ulla Corinne, Children's Services, Charlotte Haytham-Taylor, Regeneration, Pauline Jorgensen, Highways and Transport, Charles Margetts, Health, Wellbeing and Adult Services, Stuart Monroe, Business and Economic Development, Gregor Murray, Resident Services, Communications and Emissions, and I have an apology from Wayne Smith. Also in attendance is Susan Parsonage, who is our Chief Executive, and Anne Hunter, who is from Democratic Services, who will be clerking the meeting. Thank you. Before we start, let me ask for any declarations of interest. If you have any, please let me know. No, thank you. And I'd just like to make a brief statement, this is the last meeting of the year. This is the last executive meeting of 2020, and it has been without doubt a tumultuous year. I would like to start this meeting recalling all those who have sadly passed away this year, including the 189 residents who have died of COVID, or with COVID, I should say, the horrific Forbury murders of James Furlong and his friends, and James Box's sudden and unexpected death. Please could you join me in just a moment's silence. As we prepare for a Christmas that will, due to COVID, be like no other any of us can recall, I want to take a brief moment to look forward with some hope to 2021. This has been a terrible year, and I do not wish to downplay the suffering people have gone through. Whether you have lost a loved one, struggled with illness, stress or anxiety, or have been financially hit by this pandemic, my thoughts are with you, and the council is here to help. We also have a rising number of cases in the borough, and so must be vigilant and sensible. Keep the COVID-19 rules and limit the number of people we meet. We were moved into Tier 3 today with the additional restrictions that brings. As a result of significant data analysis, we have identified and will identify 6 wards, the hotspots. Today they are Winnersh, Shinfield, Bullmarsh and Whitegates, Loddon, Embrook and Sonning, where the incidence of coronavirus at the moment is highest, and we will be concentrating our efforts and messaging there. Councillors and residents are asked to work with us to change behaviour. This list of hotspots will change from week to week. It is vital, therefore, we remember and keep to the COVID rules. And in particular, at this time of year, remember that the more social interaction we have, the more we risk spreading infection. However, there are reasons to be optimistic in Woking Borough. Thanks to our fantastic voluntary organisation, health and care workers and diligent council officers, we are coping COVID-19 collectively, compassionately and with much innovation. Today, we launched one of the first lateral flow testing services in the country. I believe it to be the first, that will help people visit residents in care homes at Christmas. The tests are being offered at shoot end to those with loved ones in those homes that have signed up to the scheme. In this way, we are adding peace of mind to people who want to visit the homes, but who understandably want to minimize risk of taking infection with them. We will be assisting schools to introduce lateral flow testing in the new year. Our support for the NHS local tracing service is proving effective, with 90% contact tracing success in the borough. This is in part thanks to our introduction of text messaging tracing and door knocking to follow up on contacts. We are also helping the NHS with its vaccination programme, with care workers in the borough among the first to get the jab. As 2020 has been the year of COVID-19, it must be hoped that 2021 is the year of a vaccine. As I have mentioned, our cases are rising and the vaccination programme will take time to roll out, so it's no panacea, but it is a cause for optimism, and that is an important commodity right now. I'm delighted to announce that Woking Borough Council is launching an 18-month pilot scheme to help people with mental health issues in the borough, funded by a generous donation from a resident. The scheme will be run on the council's behalf by the mental health charity Oxfordshire Mind, giving our GPs very valuable help. Among the area it will focus are recognising mental health issues early and intervening to prevent conditions deteriorating, ensuring timely referrals to specialists, coordinating the support available for those with mental health issues, and promoting awareness of the issues in the community. The pilot service will be inclusive, ethically and able to meet the well-being and mental needs of a diverse range of residents in the borough. It will develop a way to support those with mild to moderate mental health needs, for instance, including non-medical interventions such as social prescribing, self-management, peer support, signposting and activities. It had estimated that this will support about 1,000 people each year. Apart from COVID, we have other reasons for optimism in the borough. Despite the pandemic and resulting economic problems, our regenerated Woking Town Centre is attracting new businesses that are prepared to invest at this difficult time because we have been prepared to invest in the town. The new homes in the town centre built as part of regeneration are selling fast, and the retail and business units are being snapped up. Early, Woodley and Twyford are also vibrant. This, along with our other prudent investments, are providing a sound financial base to underpin our services and improve our schools, leisure centres, roads and other community facilities. As a sign of confidence in our borough, I'm delighted to announce plans to develop the largest purpose-built film studio in the UK have been put forward in Woking. US companies Blackhall Studios and the University of Reading want to build the new 150 million studios at Thames Valley Science Park in Woking. Blackhall said the move would bring major Hollywood film productions to the UK and create up to 3,000 jobs. Notwithstanding a very challenging year, our finances are strong and our finance team second to none. Whilst there is in some incomprehensible and, may I say, uninformed concentration on our gross borrowings, our net borrowings are extremely low and interest rates are pegged for up to 50 years. We will be presenting a balanced budget which continues to be ambitious in our aim to enrich lives, safe and strong communities, the right homes in the right places, a clean and green borough, keeping the borough moving and changing the way we work for you to be the best that we can in serving our residents. The issue of housing numbers has been overshadowed by COVID, but it is vitally important to our future. You will recall that during the summer, the government proposed a new methodology for allocating housing that would have buried our borough under an avalanche of concrete, with developers able to build at will. At the time, I felt that I was a lone voice. We campaigned hard against this, and we have been successful. Our housing numbers at 759, 30 below the standard method of 789, are still too high, but considerably more achievable than the 1635 the white paper proposed. This is as a direct result of all those who lobbied for a different approach, among whom we were a major voice. And I would like to thank all the councillors, our very hard, dedicated MPs and residents for their support. Therefore, despite the ongoing pandemic, I believe we can look forward to 2021 with some cautious optimism. COVID has not gone away, and we must remain careful, in particular of Christmas, but the foundation is in place for the borough to recover strongly from this awful year. Please observe the rules rigorously, especially during the Christmas period. Help us to slow down the increase and to reverse it. May I thank all the directors and officers who have been, throughout the year, flexible, innovative and dedicated. And thank you for your considerable commitment to the well-being of our residents. May I thank my executive team for their hard work and all the councillors for their support. And lastly, may I wish you all a Merry Christmas and a Happy New Year. Thank you very much for your indulgence. Now I come to public question time. Barry Patman.
Thank you, Chairman. I would like to ask a question of the Executive Member for Health and Wellbeing, and it is, what is the sequencing for inoculation, please?
Thank you, Barry. The Joint Committee on Vaccination and Immunisation has recommended that the aim of the first phase of the vaccination programme has got to be the prevention of mortality and the maintenance of the health and social care system. As the risk of mortality from COVID-19 increases with age, the prioritisation is primarily based on age. In answer to your question directly, the priority list is: number 1, residents in a care home for older adults and their carers. Number 2, all those 80 years old and of age and over and frontline health and social care workers. 3, all those over 75 years old. 4, all those 70 years old and older and extremely clinically vulnerable individuals. 5, all those 65 years of age and over. 6, all individuals 16 to 64 years old with underlying health conditions which put them at higher risk of serious disease and mortality. 7, all those 60 years of age and over. 8, all those 55 years of age and over. 9, all those 50 years of age and over. It's estimated that taken together, these groups will cover 99% of preventable mortality from COVID-19. The next phase of the vaccination programme after this will seek to reduce further hospitalisation and provide targeted vaccination of those at high risk of exposure or those delivering public services. The planning of the second phase is ongoing, with more detail expected in spring 2021.
Do you have a supplementary, Barry?
Yes, I do. Do you think that us moving to Tier 3 is going to have any impact on the process of this at all?
It's difficult to know because it's only happened today. What I would hope to see, and will be lobbying hard for, is further support from central government in terms of, getting hold of as many vaccinations as possible, and any support they can offer us, increasing testing for the borough, so we can even off and drive down case rates and get ourselves into a better position.
Okay, thank you.
Thank you.
Thank you very much, Barry. Pauline Hellier-Simons.
Thank you. It's a question to the Executive Member for Health, Wellbeing and Adult Services. How will we be asked when we're due for a vaccination?
Thank you, Pauline. In answer to your question, the NHS is offering the priority is being given with the COVID vaccine 19 to the people who are most at risk from coronavirus. The vaccine is being offered in some hospitals across England, and from this week, hundreds of local vaccination centres run by GPs. You're probably aware that it's being issued from the practice in Wargrave, and it started this week in Finch Hampstead, and other parts of the borough will follow next week. The NHS, for the order in which people will be offered the vaccine, is based advice from the Joint Committee on Vaccine and Immunisation. The NHS recommends that all eligible residents should wait to be contacted by for a COVID vaccination. Do not turn up speculatively at your local surgery because it will not be there, and obviously those who need it need to be prioritised. Residents will be contacted by the local GP practice when the vaccine is available. Practices will select the communication channel which they normally use to contact patients. This may include, and are not limited to, phone calls, text messages, emails, or printed letters. And again, I would repeat, we need the vaccination teams to be focused on doing their job, and all residents are advised not to phone GP practices or other NHS services with general queries. The NHS will get to everybody as quickly and as efficiently as it can, in the order I set out in answer to the last question. At present, it's difficult for us to know how soon we'll get through all of the first few lists, but we'll be keeping as much pressure on to get it done as soon as possible.
Do you have a supplementary, Pauline?
Yes, you might not know the answer to this, Charles, but do you happen to know whether those of us whose surgeries are in different boroughs that will have all of that same applied?
When you say I see. So you're talking about if you've got a surgery, for example, in Bracknell Forest.
Yeah.
Mm-hmm. I would imagine, I don't know the answer is the truthful response. I would imagine they will be following the same principles because, which I read out earlier, which are nationwide. And, Bracknell Forest is obviously in Berkshire East. I was present at the Health and Wellbeing Board last week where Berkshire West was discussed, which includes obviously West Berkshire and Reading, and the same principles are being put in place there. So I see no reason to believe that Berkshire East would be any different.
Thank you. That is a good answer. Thank you very much.
No problem.
Lindsay?
Good evening. I had my question up just a few seconds ago, and I'm afraid I've lost the actual details of the question.
Would you like me to read it?
It would help me, John.
Okay. That's Lindsay Ferris to me. There will be a considerable amount of work required by Woking Borough Council to ensure that there is a coordinated and speedy route to enable our local health services to administer the long-awaited COVID-19 vaccines to our residents of the borough. This action is likely to require additional financial resource as well as the need for additional staff to provide these functions. The Liberal Democrat group on WBC supports such action. It is also important that WBC continue to provide as many of our local services during this period as possible. We recommend that WBC find someone with experience in logistics, program management or project management to ensure these capabilities are provided in a cost-effective and efficient manner. This work will be complex, and it is essential that these actions are implemented in an expedite manner. As time has been short, the information within the executive paper will be, by definition, be limited. Can the leader of the council provide additional information on this project at the executive meeting, and will he continue to provide updates on a regular basis so that all parties can be made aware of what has been achieved and what will still needs to be completed?
Thank you, John.
So that was your question to me. Do you want to answer it, or shall I answer it? Right. The answer. The Council has successfully managed its COVID-19 response since March by standing up and using its emergency planning governance to oversee planning and delivery. This is chaired by the Chief Executive and includes all the directors. The Gold meeting, as it's called, meets as often as needed and was meeting daily at the height of the pandemic. As part of this function, the Council draws on all of its resource and expertise as needed from around the council. Included in this is access to qualified and experienced programme management. This meeting tonight is to finalise plans to release additional funding that will support several initiatives across the council's COVID-19 response. This includes the delivery of rapid tests to enable care homes visits before Christmas, building upon its local contact tracing service and supporting the rollout of the COVID-19 vaccination programme across the borough. Subject to approval tonight, 500,000 has been requested to support these initiatives and ensure they can run effectively. Significant work is already being undertaken with council employees working tirelessly on the planning and preparation of local pilot of this support care homes with their rapid testing of visitors. This is an important step and will mean that care home residents in the borough could have face-to-face contact with loved ones before Christmas. To help local care home providers navigate rapid testing for visitors, the council has made the decision to manage the process and conduct these tests at its Chute End offices. There will be a range of measures in place to ensure that the site is as safe as it can be possible. Throughout the pandemic, our aim has always been to support our communities as much as possible, particularly our most vulnerable residents in local care homes. There are a lot of administrative and technical logistics involved with rapid testing, which could put an additional pressure on care homes that are already under a lot of strain. This is why we have decided to create a central test point at our Chute End offices. We will be one of the first boroughs in the UK, actually I think we are the first, to undertake a pilot of this kind, and a tremendous amount of effort has gone into its organisation. To be able to facilitate a rapid testing programme and enable residents to visit care homes before, during and after the festive period is extremely rewarding. That said, we will continue to take extra precautions, and for safety, visitors will need to keep their distance and still wear full PPE when visiting loved ones. In terms of other programmes identified, the council has already been running a successful contact tracing scheme to support NHS test and trace, with contact tracing success rate currently sitting at 90% across the borough. It is proposed that additional funding will support the continuation of this service and develop a further element of self-isolation for those who need it. In addition to this, Woking Borough has been allocated a limited number of vaccinations for care home residents and staff. While the rollout of the vaccination programme is being led by the NHS, it is supported by local authorities and in particular us, and it is expected the council will need to provide additional support to its partners as the programme expands. This will require additional resource to manage and coordinate the programme locally. We are continuing to dedicate a huge amount of resource to our COVID-19 response, and we are proud of those efforts. However, we must remember that it will be some time before we can see the impact of certain initiatives, such as the vaccine programme, on our case rates. Therefore, it is extremely important that we adhere to the rules and follow social distancing guidance to prevent a rise in community transmission rates during the rollout of these programmes. I will always, as you know, endeavour to be open and transparent in how we support our residents, and will happily commit to giving you regular updates, as I have in the past.
Thank you, John. As you know, if there's something that I am prepared to support the council with, I will stand up and say so. This is one of those issues that I think is absolutely vital, and fully support the actions. Has any grant or anything come from government to support it, or is this funded from within?
Well, it's a very difficult question, because what the government's done is given grants and said, this is your lot till March 22. So the current presumption is we're not going to get any more money. But I suspect that will change, because the new requirement for lateral flow testing for schools, which is not really completely developed, is going to require a huge amount of resource, particularly from us, to do it properly. So at the moment, the answer is no, but I suspect the future answer will be yes.
Can I just confirm, you said March 22, did you mean March 22?
I did, extraordinarily. I found that quite surprising as well, actually.
Ditto. Okay, thank you.
Thank you, Lindsay. Happy Christmas.
Yes, thank you. And don't forget, I did support about the planning and the numbers. Our group went in and lobbied as hard as we could on that issue, and I appreciate you did a lot of work. I know that, but our group did. We submitted two submissions in on that particular issue and on both papers, and we lobbied our MPs on the Lib Dem side to deal with the issue, and I believe that it looks like it's largely been successful from what I can see. So let's hope 1635 has disappeared into oblivion.
God willing, yes. Thank you very much, Lindsay. There is now a question from Gary Cowan, and Gary's not going to be here tonight, so he'll get a written answer. Laura Blumenthal.
Thank you. My question is for the Executive Member for Health and Wellbeing. Please, can you let us know what the best sources of information for residents to find out the latest COVID case data for Woking Borough?
Thank you, Laura. The answer to your question, I mean, good information on something like this is very important. And the best, most accessible and most accurate source of information to find out the latest COVID data for Woking Borough, and indeed all of West Berkshire, is the Public Health for Berkshire COVID dashboard. This website has live updates from government data sources, so contains the most up-to-date information. It clearly shows the number of new cases. Excuse me.
Bless you.
Thank you. It clearly shows the number of new cases in any given day, the weekly rate for an area, as well as mortality data. It also includes data from all of the local authorities in Berkshire. There's more detailed information prepared every week, which is found in the Information Centre and the website. This includes detailed local information about each ward and what's going on there. The web address is www.berkshirepublichealth.co.uk, or just simply Google Berkshire Public Health, and it's the first result that comes up. For those who want more data and more detail about the national picture, the government website coronavirus.data.gov.uk covers all the local authorities in the UK. If anybody wants to know what's going on, I would firmly recommend go to that site. Do not accept what you see in the papers as gospel. There is also the Zoe app that's widely touted. This has merits, but it tracks symptoms. It doesn't track cases. So if you want to know what's going on with cases, that's the place to go.
Is there a supplementary, Laura?
No, that's all. Thank you so much, Charles. Appreciate it.
Not at all.
Abdul.
Thank you. Thank you, Chairman. My question.
John Kaiser.
Yes, thank you. My question to Executive Member for Finance and Housing. Relating to item 61, can you set, sorry?
No, nothing. Sorry.
Can you set out for me how the council finance will impacted by the welcome spending of up to £500,000 to support the council COVID-19 response? Thank you.
Thank you, Abdul, for your question. Obviously, this is a significant sum, and it is a credit to how well the council has run and continues to run its finances under the careful stewardship of Graham Ebers and his finance team, that we are able to meet this level of spending to support the response to the pandemic. The latest revenue monitoring I will be presenting at the Executive in January will show we have managed to turn around the projected overspend due to COVID-19. And whilst there is more to do, there is every prospect of a final outturn on or around budget, even with the impact of the pandemic. That said, whilst the council will be able to set a prudent, sustainable and balanced budget next year, there remains uncertainties around future government settlements, which still represents a challenge. Further to this, the recent mid-year Treasury Management Report presented to the Audit Committee and following on to the Executive next month has highlighted the benefits of the local taxpayer of sound investments, including our commercial and regeneration portfolio, while maintaining sustainable debt that delivers council priorities and the setting of prudent reserve balances. Allied to this is the recent myth-busting release around the council's financial position. It is this careful and innovative financial approach that means we can afford to do this while still remaining at safe balances, unlike a lot of the councils in the country. As I keep on saying to everyone, a council which is broke is no use to anybody. Thank you.
Thank you, John.
Do you have a supplementary, Abdul?
No, thank you for his comprehensive details. Thank you.
Thank you, Abdul.
That's the end of the questions. Charles, the paper.
Yeah, thank you, John. So the paper which is before us tonight is asking that the executive agrees for a supplementary estimate to support the council's response to COVID-19 of a sum of money of up to £500,000. Now, there are three parts basically to this, which I want to run through one by one. First of all, John has touched upon, which is lateral flow testing for care home visitors. Now, the proposal here, we actually have started doing this literally today, and we're building up to a capacity of being able to do 200 people a day with this. And the idea of this is very simple, basically, that we're testing people in Shoot End. It is only for care homes which have signed up for this, which is 20 so far. And it's to allow visitors to come in to be tested, obviously, hopefully to be found negative. And therefore, they will then be able to visit their relatives in care homes and to have physical contact with them, to hold hands, to do all those things, basically to help get people through the winter. The testing's being done in a completely COVID secure way. Everybody has a booked appointment when they come in. There's full PPE being worn by those who are testing and those who are tested to keep everybody safe. And the aim of this is very simply to support our aged and vulnerable residents in care homes and to enable their families to see them over Christmas. Now, the second part of this is to fund additional contact tracing capacity. You know, as everyone knows, we've gone up to tier 3 today. And, you know, it's very important, basically, that we strengthen our case tracing as much as possible. As John said earlier, we're currently achieving 90%, but this is to build in some extra funding so we can expand this capacity going forwards and make sure that we've got enough people to deal with whatever comes over the next few months. The third part of this relates to extra funding to support the COVID-19 vaccination programme. You know, as I think, well, I touched upon earlier, the Pfizer vaccine, the NHS and the CCG started this last week in the borough, and it's well underway with people over 80 and obviously care home staff being vaccinated, which is great news. And it needs to happen as quickly as possible. Now, we're expecting a vast increase in the number of vaccines and capacity early in the new year. And this funding is basically to make sure we're in a position, if needed, to provide staff to support the NHS and CCG in delivering this programme basically as quickly as they can, which for obvious reasons is for the benefit of all of our residents. So that's the programme. That's what I'm asking the executives to support, and I'm happy to take any questions.
What is the implications insofar as you're concerned of moving to tier 3 today?
I think, John, I would say, first of all, I understand fully that especially those in hospitality businesses will be very disappointed with this being forced to close for the third time in less than a year for an unknown period of time. So there are obviously financial implications for them. There are implications, obviously, that our case rate is rising and has been rising rapidly, and we have to do everything we can to put a stop to that. Now, as you mentioned earlier, we're going to be ramping up our fight against COVID-19 with the programme of very distinct messages and targeting the 6 wards currently in the borough which have the highest number of cases, and we have to really focus on that. The other implication, I would say, is really just a public appeal to anyone who is listening to this, whether they're a councillor, whether they're a member of the public, a member of the press. You know, I mean, everyone will have their own experiences of this, but a visit I made to Wokingham last Saturday to the shops, you could see some people were not social distancing, some people were not basically, you know, wearing masks in shops. And really, it is appeal to everybody to follow the government advice. This will only work if we all work together. And, you know, so social distance properly, it's got to go back to like it was in March or April when this first started. And most importantly, if you have symptoms, go to the NHS straight away, get a test. And if you are asked to socially isolate, do it properly. The only chance we've got of getting on top of this is if we all work together to those common aims. But the implications are, you know, difficult for businesses, and we're going to have to support them. They're difficult for individuals, those who basically are now facing 2 or 3. Some people are very worried for understandable reasons about this, and those who are now facing 2 or 3 months at home, possibly, with not going out that much, they're going to need our support too. So, but we need to pull together to get through this, because the vaccination is coming, and hopefully by the mid to late spring, we should see some real gains from it. But I think from my point of view, you know, I know the department I'm responsible for will be there to support any and every resident who needs it.
Pauline?
Thank you, Chairman. Charles, that's really great news. And can I first thank you and Matt and all the officers who work on this. They've done a fantastic job. I know you're working very hard. And I certainly very much appreciate it, and I'm sure all the residents do as well. You mentioned inoculation starting in Finchampstead and Walgrave, and you said something about, I think, inoculations then moving to the rest of the borough next week. Will that be a full geographic spread?
My understanding is that the CCG and the NHS, they've split Wokingham Borough up into 5 PCNs, so 5 areas, and that vaccinations are going to be offered in every area, not via every practice, because obviously the nature of this vaccine is you need very specialised equipment to do it. You need areas with adequate car parking and where they can staff and resource properly. But every one of the 5 areas in Wokingham will be offering vaccines by the time we get to the end of 2020, which is obviously good news. And, you know, we're just desperate to see the number of vaccines increased as quickly as possible, and to help the NHS and the CCG get this programme underway, and support it, which is obviously what part of this supplementary estimate is for.
So the 5 PCNs will all start inoculating next week, is that right?
That's my understanding, yeah. That's the latest information we've had from the NHS. Every part of Wokingham will be, there will be a vaccination centre which is serving it.
Great, thank you very much, Charles. That's great news.
No problem.
John.
Good evening, Charles. I just really wanted to say, follow on from what Pauline said. Everything's driven by money, but money, once you've got it, giving it away or paying it out is the easy bit. What you and your team with Matt are doing, there is no manual for. And I would like to thank you on behalf of myself and many of my residents who you've instilled confidence in during these very difficult times. So I would just like to add to what Pauline said, and thank you very much for all that you've done.
Thank you, John. I mean, I would say I'm privileged to work with a very dedicated department, very dedicated leadership, and, you know, they're solely focused on just doing everything they can to resolve this, which is what we all need. And yeah, it's been frustration for us. Programs, basically, we wanted to get on with this. The year have been put on the back burner because we've had to dedicate all our resources to this. And whilst I firmly believe that this winter is not going to be easy, you know, I do believe basically if everyone pulls together, you know, residents actually listen to what I'm saying, basically, well, the impact of this will be better for our residents. And, you know, the end is in sight. We just have to get through this winter, basically, and help the NHS and the CCG get the vaccine delivered as quickly as possible.
Thank you, Charles.
No problem.
So there are no further questions from the executive. The recommendation is that the executive agree the supplementary estimate in support of the council's response to COVID-19 of up to 500,000. Notes that work has already started in preparation and funding that's been released by the Deputy Chief Executive under emergency powers. John, sorry. John? No? Can I...
I'm just voting, John. I'm jumping the gun.
Okay. Could members of the executive indicate their approval of that or not, please? That's carried. Thank you very much. There's really no further business for this evening, other than to wish you all a very happy Christmas and a very merry and prosperous new year, and keep safe, observe the rules, and thank you. Good night.
Good night, John. Thanks.
Good night, John.
Good night, everybody.
Good night, everyone.